Welcome to Frame by Frame, Rethink Imaging, a podcast by Imalogics. Here, we explore the intricate world of medical imaging, aiming to dissect the field and inspire both professionals and curious minds alike. I'm your host, Chris St. John. Today on Frame by Frame, Rethink Imaging, we are excited to welcome Allen Goode, Chief Diagnostic Medical Physicist at UVA Health System. With over 2 decades of experience, Allen has worked at the intersection of healthcare, imaging, and technology, contributing to the improvement of radiological practices within one of Virginia's top academic health systems. Today, we will be discussing one of the most pressing issues facing radiology departments, the short staffing of radiology technologists. We'll explore how this issue affects patient care, the quality of imaging services, and ways to address these challenges in a field that is essential to modern healthcare. Welcome, Allen.
Good afternoon. It's a pleasure to be with you.
It's very nice to have you here today. Almost dragged you kicking and screaming.
Well, I'm happy to do it. Thanks for having me.
Absolutely. So just like to warm you up a little bit, can you just tell me a little bit about your role at UVA?
So here at UVA, we have a very large level 1 trauma center and over 250 X-ray devices, imaging devices. So I have a team of about 5 medical physicists, including myself, and we're in charge of all the X-ray inspections. We're in charge of compliance, image quality, dose, which both go hand in hand, and keeping our patients safe and trying to provide the doctors with the best image that we can. And so it's quite an active and dynamic day-to-day role, and we absolutely love what we do for the health system.
Amazing. Can you talk? We already, to pull back the curtain for the listeners, we obviously know we're going to talk about short staffing today. So rather than dance around it, I'd like to just kind of run straight into it. You know, a lot of folks have been talking pretty much every episode about this massive issue. Can you tell me just a little bit about what you're seeing at UVA and from your perspective?
Absolutely. And, I think as you and I chatted briefly about, this kind of started back when COVID came around, and we started noticing the amount of techs that we had, technologists that we had in imaging across the board, be it in radiology, cardiology, everywhere, was diminishing. And I think COVID scared a lot of people, and those that were contemplating retirement retired. Those that were contemplating going on to advanced schools, they went on to advanced schools. Those who are, not happy with their job wherever they are, they decided, I'm going to be become a traveler, and I'm going to move around now. I don't want to sit in one place. And that we started seeing these numbers go down, and it became a lot, like a revolving door, so to speak, in that the ones that we did have didn't stay. And we were having trouble at many times treating patients just because we just didn't have enough technologists to help in the clinics perform the tasks that are needed for us to image patients effectively.
Yeah. And so, I guess let me start with one of my classier questions, right? At least currently, what are the primary challenges in terms of recruitment, right? Or talking a little bit about travelers versus what's the non-traveler term? Stationary folks?
Right. Yeah, exactly. Yeah, non-travelers. So, and that's a great question. We what's happening now is we see improvements, and then we see it slide back in that the technologists that are with us, the world, I say the world became small and flat, and all of the tools that we're using, like this tool right now, became prevalent, Zoom and WebEx and all these tools. And so people that didn't want to necessarily leave home because they wanted to be around their families or around, their parents, that didn't matter anymore. And folks left, and they left to go wherever they wanted to go. And once they started, doing things like traveling or moving to a different hospital, but especially, to address the traveling issue, this sets up a weird dynamic that, a traveler can actually go and work for an agency and then come back and actually work in another hospital that they came from. And a lot of times they come in with different or improved salaries. They come in with, contractual arrangements that they've been able to arrange. And it sets up a weird dynamic with the techs that are currently on staff. And this environment is really hard to work in because you've got folks working very close side by side, sometimes in scrubs, sometimes in sterile conditions. And there's a lot unsaid. And it makes for an uncomfortable situation when the goal is to take care of the patient, right? We have to take care of the patient, and they're in charge of the radiation hygiene and making sure we're effectively using the tools, the imaging tools effectively for the physicians. And so this is a very strained environment that happens. And I'm not saying it's bad. It's different. We were not used to it at all prior to COVID. And, once in a while we'd have a traveler, but now it seems like, we're having more and more of them. But I think we're trying to put some things in place to address that. But with the increasing shortage of technologists, that travelers at times are a necessity to just make ends meet, to take care of the patients. We just don't have enough hands on deck to treat the patients. And it's really unfortunate.
Right. And so am I correct in very often travelers are being offered higher salaries?
That's what I hear. And most of the time I hear this, I don't have, the salaries in front of me, but I hear that this happens. And I think that's one of the hard things, because salary matters, money matters to a lot of people in the current economy, obviously. And to have somebody, come in that hasn't been there very long, to have somebody come in and sort of start and be a new technologist in an area they've never seen and be making more money than, say, somebody standing right beside him. It sets up this, again, it's a weird dynamic, and it's unfortunate. But we have to have, patients keep coming. We have to treat the patients. And so we have to do what we have to do to get people here to help run the equipment, to help us serve the patients.
Yeah. And I feel like that almost creates this kind of, it's like a feedback loop that's gonna it's like digging the hole deeper, right? Because in theory, it would be great, to be able to have techs on staff that you could incentivize to stay, right?
Right.
To have a sustainable team that's sticking around. But you now introduce this this patch to help deal with things where you're having, you're incentivizing travelers because you need to get somebody there, so you have to pay them more. But then in doing so, it's almost de-incentivizing the thing that you actually need, which is a consistent group of reliable people.
That's exactly what happens. And a lot of the things that we do are very complicated. The procedures that we do are very complicated. It's very hard to in the medical field, we use the terminology see one, do one, teach one. And it takes a unique person to see one, do one, teach one. And so if you're a traveler or you're somebody just starting, to see one, do one, teach one for something that's, a more simplified procedure or exam, that's probably okay. But a lot of the times we're working on very complicated procedures, and to see one, do one, and then teach one is very difficult. If you're just starting, or if you're transient, you're only going to be there for 6 weeks, you may only see one, you may only see two of a certain procedure or exam. And so it's very hard for, you to, lend your hand and become competent in that area. Whereas the techs that are, technologists that are still here, they're doing that, and as you're right, it sets up a little bit of animosity between those folks, because they're like, well, I'm here and I'm doing the job, but you're coming in and you're basically going to say see you in a few weeks. So it's unfortunate, really.
When you say see one, do one, teach one, right? You're talking about at the exam level, right? And are you being literal when you say one, or is that just language being language?
I think we do a lot of that. I think that is, and I heard that physicians speak of that a long time ago. And when you think about things through that lens, it happens a lot. You may not see a complicated IR procedure more than once as a technologist, and you've got to retain everything that you learned on the last one, because patients are different. And so you see one, you may get to do the next one, but after that, you're going to have to tell somebody else that doesn't really understand what's going on, what they're doing and what they need to do to correct that, when it may change in that procedure as well. So it's only being transient in some of these areas like IR and catheterization and some of the more advanced imaging modalities is, MR and CT. It's very hard. It's very hard to have these folks come in and stay for a short amount of time and then they leave. Yeah, it's tough.
Yeah, I mean, how do you try and tackle like systematizing teaching travelers or just teaching new techs like during the C1 period, during the C1 phase, right? Like is there some sort of like systematic approach, or like I don't expect y'all to have time to be like building back end systems, right? Because you're already not having enough time. But I'm curious, like, what the approach is during the C1 phase, and like, is there some sort of structure that could be implemented to kind of smooth that out?
Correct. Yeah. And we do a relatively good job of that. We expect that somebody on their first day is not going to be able to handle, say, a trauma and CT by themselves. Unless you've been an imaging technologist for a long time, to be able to do it, how we do it, and many hospitals do it their own way. We all have our own ways of doing things and the way the doctors like to see the images. And so there's usually quite a bit of mentorship that goes on during that first or second one. But then very rapid in this dynamic environment, you're right, you got to kind of get it pretty quickly, because otherwise you are going to be in a situation where somebody else has left the room and now you're doing it yourself. And most of the techs are very good at doing that. They're very good at, watching this procedure or exam happen and running with it. And so we're fortunate for that they all do a fantastic job of doing that.
I'm going to talk about AI. Sorry, everybody. So just like, I'm going to talk about technology in general, excuse me. Given all of this, like, given the explosion of AI, given the explosion of different technologies in this field, like are there things that you see also like tech solutions to being able to address things like this, or at least not at this point?
There are, but they're small and they're kind of hidden a little bit. I see them because, I've been, as you said at the intro, I've been doing this for a few months now. And, you see what we used to do and you see kind of what we're doing now, and you kind of get a direction of how things are, are going to, where they're going to. And I think some of the things that, we're looking at are streamlining processes where, if somebody comes in and they're going to have X procedure or Y procedure, the machine, the X-ray machine or the MRI or the CT or whatever we're using already knows ahead of time what we're doing. It changes things around, especially like in IR, it will move around and do the things it needs to do to get prepared. So it's one less thing for the technologist to worry about, so that they can focus on the patient. They can focus on what tools do we need to do this procedure, that kind of thing. And so things like that are helping them. But also, I know that digitally, we're taking advantage of a lot of those things by automated routines. If we're always going to process the MR or the CT a certain way, it's a lot easier to build that into something that says, every time you see these keywords, process it this way. We're not going to do it any differently because we want them all to look the same. We want them all to look uniform so that when something's subtle, it pops out at the physicians. So, I think things like that are taking advantage of some of the AI that's out there and doing some things ahead of time, so that the techs don't have to do some things that they've always done, so that they can turn their attention to, is this other thing set up correctly? Have we documented some of the things that we need to document legally, ahead of time, those kinds of things, and allows them to focus on some things that can frankly be done by a computer pretty well, whereas there's a lot of things that cannot be done by a computer. So I think those things are coming. I think we're taking advantage of some of them. I don't think the technologists will be replaced in any way, shape, or form. In fact, we need more of them, as we've sort of said. But there are some things that computers can do easily for us to make their job a little more streamlined and a little easier on a day-to-day basis.
And I feel like, correct me if I'm wrong, but like, just because there's tools to help them do their job well, if you have like a constant backlog of patients that you're looking to get through, like, yeah, it can maybe help your techs get through the patients faster, but like it's not like it's going to address their burnout. Yeah. Like,
And that's true. That's, yeah, you've touched on another point, is burnout. And I was just talking to one of our imaging managers the other day, and that, last week we set, records at our institution for the number of procedures. And it's not like we're not a hotel. We can't turn people away because the rooms are full. They keep coming. And it's very hard when you've got technologists that are already working, lots of shifts. And as you say, the logs continue to get longer and longer of patients awaiting imaging exams. It's very hard to not get disgruntled. It's hard not to, go, we'll just never get there. And, so you have to be creative a little bit. You've got to, lighten it up a little bit because, they're working long hours under duress. And so we try to do what we can to incentivize them, just to, take a minute and think about how things are going, and just being creative a little bit to help them get through the day, and providing them some, some things to think about other than just, one patient after another, because it's not cookie cutter. Every single patient's different, and having them, work through the situations and helping them work through those situations the best we can is we try to do it all the time.
do you have any advice for, like, let's say, some other techs somewhere who don't get to work with you? Do you have any sort of like little sound bites you can give me to talk about dealing with burnout?
Yeah, I mean, I one of the things I think that we've gotten away from in the imaging world, when I first started, things were quite a bit different. They were a lot slower. They were a lot more analog, whether it was film or not. They were a lot more analog. We didn't have these digital systems where, things could be ordered, faster than, we can even say the words or make the order or whatever. But I think back in those days, we invested in technologists a lot more than we probably do now. And I think, and I'm talking about this across the country, that we've gotten away from sending technologists for training off-site in some times that where we can send them off and invest in them. Make them part of the family, make them part of the decision process. What do you think is going to help, the situation tonight when we got 10 patients? What have you seen has helped in the past, as opposed to you just got to get it done? That's not helpful. And that adds more stress and duress, to them. But I think, involving them in the situation, because they're at the, at the front line, and saying, what do you think will work, and trying to help implement what they say, and also giving them a voice in the process. I mean, those are the sound bites that we always talk about, and try to involve them as much as we can in the process. After all, they're the ones that know the machines quite well, and they're the ones that help the doctors take the best, images. And so I try to work with my techs as much as I can. What are you seeing? I have my opinion about what I see and what I think the problem is with the machine or whatever. But what are you seeing? And it helps. I feel like it invests in them, that hey, I very much deeply value their opinion about what they're seeing, because they see this machine all the time. I'm sort of, at the shop. I'm sort of, they brought the car in, and, that kind of thing, and they drive it every day. And so when they're saying it's pulling to the left, for me to just say, nah, it's not doing that. That's, that's sort of, that doesn't make them feel very good. And so I think just trying to invest in them as much as we can, and giving them stakes in the decision process, and so, that they can be involved. I think those things help ease some of the burdens and things, the stresses that they're under.
Yeah, for sure. It honestly, it is very akin to my restaurant life, where like if a server, comes up to me after, 6 months of getting shit done, and has an idea about a way to streamline things, it's like, I haven't been waiting tables. Like, yeah, absolutely. Like, if you think it's going to work, I didn't think of that. Let's give it a shot. But and then on the other side of that, though, like, I totally understand, administrators are underwater as well. And, they're also trying to deal with 16 million problems. And now they have a tech who's like, hey, I've got an idea, and they don't even have time to listen to it.
That's true. Yeah, that happens a lot.
There's a lot going on.
Yeah. Yeah. The speed to which that we work now, the speed, how fast things arise and get dealt with is at a rate that we're just not used to as humans. We're just not used to, the phone call, the pager, the text message, the person at the door. Everybody's saying, because they can, right? All these communication mediums can happen near instantaneous, and a lot of times, an email is sent and the problem's already been resolved by the time somebody even reads it. And so, that means that a lot of problems are, bubble to the surface. And so it's hard to sort of, tease out which of those problems are the most critical for the administrators and for some, to hear the technologist going, I have a solution for why we're not getting through patients in a timely fashion and, this shift. And the administrator may be dealing with all kinds of other problems that we don't even know about, from billing to HR issues or whatever. They've got to weed through that at a rate that I think is, unfortunately, very hard for humans to deal with. There's a lot of communication overload, and they have to deal with that, unfortunately.
And so I guess to slowly start to change gears. So what are healthcare facilities doing right now, or what trends have you seen in aside from travelers, right?
Right.
What approaches are you seeing people take to try and address this issue?
That's a great question. And I think one of the things that we're seeing is for us and other folks out there is that what used to work is not working anymore. We cannot just wait for technologists to come and say, we really would like to work at your institution. And so you have to be aggressive. You have to spell it out. What are we going to do for you? Why would you want to work here at the University of Virginia? Why would you want to work, wherever you're at? And what are we going to do for you that's better than someplace else? You've got to make yourself look attractive. And so you have to do things like think out of the box. You've got to get into the high schools. You've got to, go into areas where people may not know what a technologist even does. Most people see the big building and they're going, I'm going to have a procedure. They think doctor and nurse. Valid thoughts. That's what we're all trained to think about as, doctor, nurse. But there are a lot of other people, including technologists, including IT folks, including physicists, that are making the solutions happen for the doctors and the nurses, that are support staff. So you have to get in front of them and say, have you thought about this? If you like computers, would you like to do this thing? You don't have to be perfect with people. You have to be pretty good with computers at this point also as well. And so I think you have to get in front of them. You have to tell them about this trade that they may not have heard about. You have to set up training programs for people who are coming in the workforce that may not even think they're going to be dealing with patients, but they've got, some sort of beginning nursing career. And you say, hey, what do you think about being a technologist? And could you work in, say, MRI part-time or even 3/4 of a time, learn it, and then, go back to school while you're doing it, those kinds of things. So these sort of training programs to become a technologist, maybe the ones that aren't even x-ray techs at this point, you have to be, thinking outside the box because they're not just lining up to come to you anymore. As I said earlier, that the world is small and flat. They're going wherever whoever's barking loudest, whoever's going to pay the most, and whoever's going to involve, have the most incentives for them, and so they're going to go there. And so if you're not trying to capture some that otherwise would not be technologists, and you're not trying to incentivize the ones that are coming, you're kind of selling yourself short. So we're doing. I think it's a full court press in basketball terms. We're trying to do everything that we can. We're going to, job seminars and things like that, and hanging our shingle out there going, please come to work for us. Whereas probably in the past 15 years ago, we didn't do that, that technologists were abundant. So we're just saying, hey, you should come here. Here's what we can do for you. We're doing that a lot. We're getting into high schools. We're starting training programs. We're doing as much as we can across the board just to try to, make this work.
Yeah, for sure. I've heard very casually in passing conversation, I don't have any hard data to support this claim, but I have heard that some institutions are willing to help pay for technologist schooling in exchange for a certain number of years as a tech. Is this something that you've actually seen in practice, or is this just like a daydream?
No, that's actually true. Yeah. I mean, so, the problem is, and back to where sort of this conversation started a little bit, at the end of the day, we have to treat patients. And so if you've got 20 patients coming to a clinic that can only do 4 or 5 at a time, and you only have one or two technologists, it's going to be a long day. And so if you can train folks that aren't technologists on the fly, if you can at least have them help the technologists that are there, they can learn while they're here, they can earn while they're on the job, and they can probably get into school, start school with some training. That's a win-win. And then, yeah, I guess there are, programs around where you can keep somebody here or incentivize them to work for a year or two before they leave if, the education has been covered. And so I think that's a win-win, because we really do have to have the people on site to take care of the patients and run the machines. I mean, let's make no bones about it. They're running the machines. And so if you don't have people here, or if you don't have people that can be with a patient while the trained technologists can run the machine, it's going to be a long day. And there are a lot of things that folks can do to learn in the clinics before actually running the machines. And so I think we're taking advantage of that as well. But yeah, I think that's another win for both sides, is to, pay for education and get people in the door.
Yeah. And so thinking about different types of people getting educated, tapping different labor pools, what sort of, I transitioned from restaurants into, a vendor marketing position, for lack of another term, from a vendor to a podcast host. What am I talking about? And I feel like there are so many different skills that I had that have kind of transferred over into my new role, right? Like podcast hosting, I see as a one-to-one with bartending. When you have someone like a single person at the bar who wants to talk to you, right. It's like, it is uncannily the exact same thing. You know what I mean? So like, what are the traits and qualities that, or like, what are the je ne sais quoi skills that, y'all would be looking for in terms of technologists?
Well, and I think things now are obviously much more computer driven. And so we like to have folks that are not scared of a computer. A lot of the things we teach. So it's not like you're going to have to do programming. It's not like we're going to set you down and say, here's a set of code, you're going to have to analyze that. That's not what this is about. But you can't, everything that we touch is computer driven. So you have to have a basic set of computer skills. And then I think the desire to learn. And I think that's the thing that, we're constantly evolving and constantly changing. And so, when a technologist, and I've seen a few that come in and they get very, they'll get set in, well, this is not what we did yesterday, because today is today. We change, we evolve. We can't help it. We have to evolve. We have to change. We learn things about what we've done, and we say, look, this is the way to do this better. And so we may do it different tomorrow or next week. And so just the ability to, sort of change and evolve day to day. It's a unique skill set. I understand that it's a unique skill set, but just the desire to learn and to improve, with day to day, and have a little compassion with humans as well. I mean, the human element cannot be removed. We're treating patients, and each one of them is different. We're treating them with, complex devices that continue to get more and more complex. They have to, sort of evolve with that equipment and say, I realize that what happened yesterday may not be the way we're going to do it today, because we learned from that yesterday. And so that does take a special skill set. I think we have a lot to offer. I think it's a very steady income. It's assured income, that's the thing, and so we can incentivize that, and say, look, this is, if you're here and you're doing a great job, we want to keep you as long as we can, because we like having people here that do fantastic jobs, and that we don't have to train every single day to do the job because you're brand new, that kind of thing. So
I might have brought this up to you like very casually the other day, but I have this theory and I'm not saying it's correct. And I also would like to emphasize that I am saying this with the utmost respect to all imaging professionals. I really believe that I think millennials in the service industry is quite potentially an untapped labor pool that imaging could be pulling from. Let me lay out my theory for you, and there's no guarantee we're putting this in the episode. Okay, so I decided to leave my restaurant job where I was the chef and owner of a very successful New Orleans restaurant, and wedding venue and catering company, effectively. We survived the pandemic. I have a Princeton degree. I'm quite competent. I'm great in an interview chair. Leaving restaurants
You are.
was, yes, thank you. Well, now on the other side, but I'm talking about in that position. But trying to get out of the service industry as I was 31, 32 when I left, felt like an impossible task. I think like so many millennials raised on the Food Network, I was like, I want to do this because I'm passionate about it. I'm not falling into it. I'm doing this by choice. And restaurants also have their own form of burnout, like many industries do. I burnt myself out, unfortunately. But trying to get out, I think I hear a lot of people saying, no one wants to work these days. I sent in probably like 1,000 resumes, 200, totally like well-written cover letters. I can write decently well. I got like maybe one interview or something. And, luckily when I was connected with Immunologics, we ended up being a match. But, my partner is having this issue right now as a former chef. And so many other friends of mine in the service industry, and especially in their 30s, are looking for a pathway out. They're looking for stability. They're looking for just anything, right? And the pathway doesn't necessarily seem clear. But in my mind, so many service workers, especially the millennial ones, are very computer competent, right? Chances are they have the people skills, especially if they were customer facing. And that adaptability that you're talking about is everything that service life is, right? New specials, new dishes, like table flip, like there's like things change every single day. Systems change every month. Like it is a constant updating, rotating, growing, evolving field. And these are people who are experienced in that and looking for more stability. And I wonder if there's a way for healthcare facilities to start tapping into this. It is a massive pool of people looking to get out.
I think you're really onto something. Just the way you described it, it's absolutely a perfect situation because that's really what we deal with on a daily basis. And I envision, in the restaurant business, you're juggling a bunch of balls, and you have to do that because if you drop one of the balls, and I'm not figuratively saying you're going to drop the plate, but somebody's not going to get what they're asking for. Somebody's not going to get their ticket in. Somebody's not going to pay. Something bad is going to happen that on that level is not good. And so the same thing happens, I think, in medical imaging, where you depending on what service you're talking about, nuclear medicine, for example, where you've got a patient in the waiting room, you've got a patient in the soak room, you've got a patient needing to get injected, and you've got a patient under the gamma camera. Depending on what hospital you're in, you're doing about 5 or 6 things. And at the end, you've got to get them through each one of those steps effectively, because if you don't, they're not going to get their imaging, and we're not going to understand, what disease process they came in for us to evaluate. And so I think you're really onto something, because I think
that sounds just to crack a joke. Once again, all the respect for the very important and difficult work y'all do, but that sounds exactly like waiting tables. The drinks phase, the food phase, the specials, the back, the first course, the back. You know what I mean? Do you need the constant bouncing around, hip hopping, constantly change? Yeah, keeping everything on track all at once.
That's exactly what has to happen. We have to keep things on track, and we have to move the patients through the system because there's 5 or 6 waiting to get in. Same thing, there's 5 or 6 waiting to come in the front door, to be served for you and for me. The same thing happens, and I think you've really stumbled on this. And you do have to have a unique set of skills to deal with people. And I think that's something that can be learned over time. I think we're not just born with this innate, I'm great with people, but as you deal with the complex situations that you deal with, the disgruntled customer, the overly, happy customer, you did so great and you're like, I've got to go to another patient, or I've got to go to another table. Thank you, but I got to go. You learn how to deal with these situations in a way that helps you move along through the process, or helps them move along through the process. So I think you're really onto something, and I think you should continue on with it because we really need technologists in the field for sure. And so if there's an untapped pool out there, I think we ought to start dipping into it to get folks out.
That's how I feel. Also, not to dissuade anyone from reaching out to high schoolers, but like I cannot imagine myself at 18. Like, I know you're not locked into a career path, but I cannot imagine at 18 being like, yes, a nice stable career as a technologist. Like, I will do this until I retire, right?
Yeah.
But but if you're looking at 30-year-olds, they're like, please give me a stable career, please.
Yeah. And the demand is there. That's the thing is I think, a lot of it, the demand is there for workers in the healthcare industry across the board, not just techs, but everywhere, that if you want to stay in a place for a long time, you're there. You are effectively there. And I know a lot of people are moving from job to job and you're like, hey, you could do this. And as long as you do a great job and you do what you're supposed to do, the healthcare organizations want to keep you because people keep running in the front door. So we got to keep them. And so you can't underscore the stability of working in the healthcare. It is hard work. I'm not going to sugarcoat it. A lot of, and the same in the restaurant. It's very hard work. Some days you go home and you go, how did I even make it through the day? But they're not every day is like that. A lot of days will really, really, really impress you of the number of things you can accomplish and the impact that you can make in people's lives. And so not every day is like that, and nobody would be able to sustain it. But I think, boy, you're really onto something in the industry there. If you could tap into that, we ought to figure something out there.
We're gonna have to circle back on this one. But I will say my data points are strong of the very small handful of restaurant friends of mine that I have talked to about this. I think like 3 out of the 4 of them have already been doing research into these programs, which sample size of 4, Dr. Sameh and I talked for 2 hours about data and numbers. I understand the size of my sample size, but at the same time, it's encouraging to me.
Yeah, you're really onto something. I think you should keep going with that. We really need the people. We really need the workers. So keep going with that.
Yeah. And so we are nearing the end of our time. Before we say goodbye to everyone, do you have any closing thoughts on short staffing or any points that you were hoping to make that you have not so far?
I think you've raised some awareness that folks may not know about. I think healthcare is a really rewarding field. I got into this field because I wanted to be it was pretty clear to me I wasn't going to go to medical school. So I kind of wanted to be as close as I could to a physician and help as much as I could. And there's so many opportunities to help in healthcare and be a part of the organization that I think and you guys are doing a fantastic job of getting the word out. How can you help? And what are the benefits to you? There are a lot of benefits to you to working in healthcare. It's very stable. I just think we need to continue to get the word out about, things that you can do that are not, necessarily nothing wrong with being a nurse, nothing wrong with being a physician. Those are fantastic, great job roles. There are so many other things that you can do to help pick that ball up and push it forward for healthcare so that you can help the patient get through the system and making a real impact, especially in medical imaging. That's where I come in, is medical imaging. So there's so many roles that are out there that could be filled by somebody who really, wants a steady job and wants to make an impact to healthcare. So,
honestly, that reminds me. I believe I was talking to Tom Griglock on a previous episode, and he was talking about how often these healthcare positions become in the family, right? Like a nurse whose mother was a nurse, a doctor whose parent was a doctor, et cetera, et cetera. And so, I think there is a snowball effect that can be harnessed by getting the word out in the right way. The question just is how do you start to get the word out?
Yeah, I think you guys are doing a great job of starting that or continuing with that.
I guess we're doing it now.
You're doing it now. And yeah, I mean, I think you're right. I mean, a lot of people don't even know about some of the roles that we have in healthcare. And so as a mother or father, do those things and they see their kids doing those things and they go, wait, you got a steady job and, pretty good pay, maybe I should do that as opposed to doing this other thing that I was thinking about doing. And so if they're successful, then that's typically handed down and, you can see the success being passed down and say, okay, well, that's clearly what I want to do, kind of thing. And so I feel like that was maybe broken for a while. Maybe it wasn't, but I don't have any data on that. But it would be nice to see that happen again, where we can, like you say, it's kept pushing forward by the family, and folks are continuing to work in healthcare. Because you do see that. You do see that in nurses a lot. You see that in physicians a lot where, it's in the family and people continue to stay a physician, keep it, become a physician and keep it in the family kind of thing and keep handing that down. And so it'd be nice to do that for some of these other roles as well.
Well, all right. That is all the time we have today. Allen, thank you so much for joining us. And
thank you.
I hope you will join us again sometime.
Maybe I will. It's been a pleasure. Thanks for having me. It's been a fun time.
Thank you so much. Frame by Frame Rethink Imaging is brought to you by Imalogics. Here, you'll find engaging interviews with thought leaders, experts, and patients, sharing stories that showcase the transformative power of medical imaging. To discover how Imalogics is rethinking imaging in healthcare, visit imalogics.com. Be sure to subscribe to Frame by Frame Rethink Imaging on Apple Podcasts, Spotify, Google Podcasts, or wherever you listen. And from all of us here at Imalogics, thanks for tuning in.